All right, are you ready for what's hot? We talk about stories that have all of us talking.
And we're joined today by professional spokesperson Ramon Candelaria and Ben Marins, president of Ben Marins Consulting. So Major League Baseball facing renewed questions about safety. It comes after an Atlanta Braves fan died after falling from the upper deck. This is the third death at Atlanta's Turner Field since 2008. Across the country, more than 24 fans have fallen at stadiums since 2003, and several other people have been hit with foul balls. Do we need to do anything to keep fans safe? Is this just, you know, at least getting hit with the foul balls? I don't know what you can do about that except for paying attention. But what about this falling over the railing?
Well, that's just it. By the way, good afternoon, everybody. Ramon. I would like to say this is an issue that is problematic. It's troubling, but it's not a problem we have to solve. If you go to a baseball game, you have to be aware foul balls come your way, and you better be paying attention and not watching your iPhone. But those of us who do that at the games and not paying attention are destined to have that ball find us, and that's what we've seen happen. If people are drinking too much, they've started curbing how much drinking can be done after the 7th inning. That's probably a good idea. In the case of what happened recently in Atlanta, it was a guy who was a longtime season ticket holder and apparently somehow got too close to the rail and fell. Nothing could have stopped this.
I agree. You make some really valid points. At the same time, I think professional sports makes enough money to really create more safer environments for people. And I love the bleachers like the next person. At the same time, when you look down sometimes, it's intimidating and scary. And I think that
Ramon,
if you're looking at the fan base, you really have to...
You'd have to put some sort of wall or netting up. You know what? Fans have to be
And I think professional sports can afford to do that, even if it's a glass wall.
It's a mistake to do it. Individuals have to be responsible for themselves.
Absolutely.
But when you're sitting in some of these ballparks, the second, third deck, and you're in that front row, and you go after a foul ball, your instincts do not, because you're new to that situation, do not tell you that that fence or whatever the railing is there isn't going to hold you. It's shorter than you might expect.
Look, I played baseball at a college level, and it takes years to be able to have that hand-eye coordination. And I think that at this point, you're going there to have a good time. And I agree that there's...
Ramon, the problem with that is 8-year-old kids with baseball gloves catch foul balls all the time at major league stations, stadiums all over the country. So they don't have to develop any special skills. The people falling over are not necessarily reaching for balls. I mean, the only way to protect them from that is to somehow block the view with netting or rubber cushioning, and I think that would be ridiculously overcharged here.
Before I end, I do want to send my respects out to the family. It's a tragic situation, and we shouldn't forget that.
Of course.
At the same time, you know, it's a different time, and sports are becoming more popular and more people are coming at all ages and age groups, so we really have to figure out ways to work together to create a safe environment. That's just the bottom line.
All right, you guys, we got to wrap it up. We got to wrap it up. Thanks to both of you.
That's it.
All right, coming up next, we're going to reveal the viewer's choice topic of the day.
And Scott Steele's back with another look at summer in the forecast. More of what's hot. We got our viewer's choice topic of the day.
Again, we're joined by Ramon Candelaria and Ben Marins. Today's viewer's choice topic. There's a growing doctor shortage in this country, and it's expected to reach 31,000 within the next 10 years. More patients are now turning to nurse practitioners to help fill the gap in primary care. But not all doctors and not all states are on board with that decision. Are nurse practitioners an adequate replacement for doctors?
I'll tell you, I don't think we should be replacing one group with doctors. I think we all deserve an opportunity for the nurse practitioners and the doctors to be working together. I think we shouldn't be compromising the health. I mean, that's one area in our lives that is the most important, our health. And
Ramon, I would agree with you on that. You know, 15 years ago, I was interviewing experts at the medical college on public radio, and we were talking about the need to have another medical college in Wisconsin. It was going to take 10 years from idea and fundraising to putting a shovel in the ground to opening the doors. We didn't do it. The shortage across the country means we have to find another way to treat people in the most base level. We're doing it with nurse practitioners, and it's not necessarily the worst thing in the world, but the trend here is to depend more and more on them. I know many of them, and they're very good at what they do, but there's a difference in medical training between being a nurse practitioner and being a doctor. This can be a very frightening trend, but again, without it, and without more doctors, there's just less health care.
But you're saying it's okay for certain things. You know, a lot of these pop-up clinics, like at some of the Walgreens and CVS, are staffed with nurse practitioners. So I have a cold. I've had it for like a week. I want to know if it's, you know, viral or bacterial. Can I get an antibiotic?
Right, but you're seeing more and more people misdiagnosing, people that aren't trained to look for specific things, misdiagnosing patients, and long term, it's not going to help us, especially the economic impact of something like that.
Courtney, that's not a problem unless what they're missing is there's actually a more serious problem that's causing what you thought was just some sort of virus or bronchial infection, and that's where the doctor's training comes in. The nurses just don't have it.
All right, we'll move on to our lightning round.
And Walmart. It's getting a head start on the holidays. Feeling like Christmas, anyone? The retailer has already started its holiday layaway program 2 weeks earlier than last year. Should we thinking about Christmas, talking about Christmas? I mean, we're not even
in Halloween.
We're not even close to Halloween yet.
My birthday's Halloween. Can we get to celebrate this a little bit? You know what's sad about this? It's for the people who are going to need some help with the financing. This isn't the worst thing. The problem with this is how indicative it is the pressure to spend for Christmas as opposed to spend time with people, to help, to volunteer, to give. And two things are going to come back to bite people who do this. One, we're looking at expanded health care costs in mid-October, and we don't know what they're going to be, but we know they're going up, not down.
We have to, I agree. We have to take this economic piece out of Christmas, although it's a very important piece for our cities and states and our country. At the same time, the spirit of Christmas, of what it stands for, I think, just the joy and all that. I don't care what you put in front of me until the snow comes, it doesn't feel like Christmas.
Well, the other thing, too, the longer you lay it away.
You got your blinders on, right?
Yeah, right.
You lay this away, and the interest builds up. If you don't pay it off, then all of a sudden it's zero interest.
It's more about economics than it is
If you get
Christmas.
to the until, you get clobbered, and this is going to make Christmas more expensive. This is not a friend to the consumer at all.
Yeah, every time we have this debate and this discussion, I keep thinking, well, they must be doing it for a reason because so many other people must think this is a great idea. Otherwise, they wouldn't be doing it.
I think a lot of people like to buy early so they get it finished, and then they can enjoy more of the season so you're not running around like a crazy person. But I'm not one of those people.
I also think there's more pressure to buy more expensive gifts and more high-tech gadgets, and that takes time for some people. But, getting back to the basics of what it's all about, and I think,
this is about the economics of make the Christmas sales season last as long as you can. If it could last 11 months, they would do it. This is not good for the consumer. It's great for the company.
But after the show, I want your Christmas list, okay?
Sure.
Oh, I can give you mine.
I'm looking forward to giving it to you.
All right, you can read.
I know what I want.
Yeah. You can read more about the What's Hot topics online at TMJ4.com.